You guys, you can't watch TV for too long or listen to the radio before you hear an ad or two for male hormone, testosterone, low T, all those terms. They say, guys, when you get old, we get less manly.
True.
To an extent, a scientific extent, perhaps. Really, what does that mean? Joining me this morning from Balance Medical Day Spa up in Irmo, Dr. Tony Chahaun. Good morning to you, first of all. So let's talk really about testosterone T. What is that? I know it's kind of what Peter Brady went through when his voice started to change, right?
Very correct, very correct. So low T, I'm looking more at low T, low testosterone.
Mm-hmm.
So as we get about age 40,
okay,
we lose 1 to 2% every year.
Right.
Okay? So it starts dropping. So it's going to affect your energy, your libido, your muscle strength, your workout. So we got to replenish that.
Okay.
And so there's different ways to do that.
So you have there's treatments you can take. I know there's a ton of different ones, right? So when you talk about testosterone, that's what builds us, and it builds up and up and up, and I guess there's a tipping point then.
There's not a tipping point. There's a range.
Okay.
Okay. So you work within that range. Okay?
Right.
Normal range 300 up to 1,000.
What do you when you're 18? Does it grow? I mean, are you born with it? It is what it is.
It peaks and then it gradually comes down.
So at 18 we're done.
Not 18.
We're done. At 18 we're done.
40 we start coming down.
Right, okay.
Right? Yeah.
Now, is there anything in diet we can do before we get into specific treatments or anything like that?
Sure. There are certain foods that will give you increase your testosterone, like tuna, beef, beans,
right,
anything you can think of maybe with some proteins in it.
Right.
That will help increase that.
Sure. Now, the testosterone, that controls how deep your voice may be.
Among other things.
You know, hair, things like that.
Yeah.
Okay.
So there's a couple of things you got to watch out from a medical standpoint.
Right.
And so you got to get your clients in there, check them out, do some lab work, and make sure they're appropriate for the treatment.
And get a specific number, kind of a baseline
Sure.
to start. Because we're going to continue on and talk about testosterone and actually what the treatments are and ways that you can not only get checked,
yeah,
which you may or may not like, gents, I'm just saying, and what that can actually do for you as you cross that 40 mark, which Tony and I will get to in about 10 years.
10 years.
10 years away. We're going to talk about that. Balance Medical Day Spa up in Irmo, talking about men being men. Give us this. Come here. Look at this. Stay with us. We're coming back.